Hello, everyone. Happy Veterans Day. It's Terry Walsh, your Executive Director and the CEO. I'm glad to see you today. I just want to wish all of the veterans out there and all the spouses of veterans, family members of veterans, happy Veterans Day, and thank you for your service to our country over the past decades in preserving our freedoms. And I just want to say thank you very much for all that you've done for our country. I know that we were going to have a Veterans Day luncheon today, an event for all of our veterans, but we're unable to do that with our current COVID situation as we're trying to protect everyone from a spread of COVID. Just to give you an update on our COVID situation, we do have 3 residents on our campus who are positive for COVID-19. Actually, we have 4 residents. We have 1 resident in the care center right now who is positive for COVID-19. They're not showing any symptoms. Everything seems to be fine, and they're being well taken care of. There's another resident in Fountain View Assisted Living who is also positive for COVID-19. We discovered that on a routine test for all of our residents at Fountain View. They're also not experiencing any symptoms. They're doing well, and they're being well cared for. And we have now 3 now assisted or independent living residents in our campus who are tested positive for COVID-19. They've all been quarantined. In fact, all of them were previously under quarantine except for 1 prior to even suspecting that they may have been exposed to COVID-19. So none of them have been around the community except for 1 that we're aware of. And as you saw in a letter that we put in your mailbox on Monday, that particular resident is part of the drama club and had been in a drama club rehearsal last Friday and potentially exposed other members of the drama club. So all of those members of the drama club, unfortunately, we have asked to quarantine. So everybody's doing fine. We haven't had any reports of any symptoms for COVID-19 from anyone else. We're monitoring the situation very closely, as you might imagine, just to make sure that we have contained any particular spread, should any spread have occurred from that case, and we're not sure that any has. We're just taking precautions to make sure. In light of that, as you know, we've already suspended our group activities between now and then. One of the reasons we're not having the Veterans Day lunch today is because we don't want to exacerbate any particular spread of COVID-19 should anybody who may have been involved with the drama club or anywhere else where maybe that resident has roamed before they knew that they had COVID. We just want to make sure that it hasn't gotten to anyone else. So we're trying to tamp things down and just hold things steady for a while. And next Monday, if all is well and we haven't detected anybody with any symptoms for COVID-19 resulting from that particular case, then hopefully we'll be able to open up to group activities again. But we're just holding it down for now as we move through this week, just to see if anybody may have caught anything, just to be careful. But as you should also know that all of these residents are under quarantine. They're not coming out of their apartments. 2 of them hadn't been out of their apartments anyway, or their villas even before they were detected to have COVID-19. So the risk of spread from them is minimal. The one that was in the drama club is the one that we're a little bit concerned about, just making sure that it hasn't spread anywhere. So I appreciate everybody's understanding. I know that Thanksgiving is coming up. We've had a couple of inquiries from residents about whether they can have family over here for Thanksgiving or whether they should go see their families or not for Thanksgiving. And the first thing I want to say is this is not a prison. You're free to do what you need to do to go about doing your business and leaving the campus. We have not locked down the campus, and we don't intend to do that at this point unless things get really bad. But I do want to caution against bringing large numbers of guests and visitors and family members to the campus. We know for sure that at least 2 of our positive COVID residents caught COVID from a family member who was visiting. And so I just caution you against doing that. The family members didn't know they had it when they brought it and gave it to their parents here on the campus unknowingly and innocently, but they still did it. And my concern is if residents bring large numbers of family members over for Thanksgiving, while I really like that idea and I know that we've got to have our connections with our families, there is a significant risk that somebody in that group of visitors could potentially have COVID, particularly given the situation that we have in the community today. Somebody could potentially have COVID and not even know it and bring it to you. And that's what we really want to guard against. My goal is to keep you safe from COVID-19. I can't keep your family safe, but my goal is to keep you safe. So I would ask that you really consider or reconsider whether you're inviting large numbers of family members over to the campus for Thanksgiving, or if you are going to visit your families for Thanksgiving, please be careful and please be mindful of wearing the mask, maintaining your social distancing, which is very hard to do when you're visiting somebody in their home, and not making contact. And I know that's nearly impossible because, like magnets, grandma and grandpa want to hug the kids and grandkids, and in some cases the great grandkids, and it's really hard to resist that, but you need to resist that because you don't know who has it. If you are going to go visit, revel in at least being in their presence, but please try to avoid contact because, again, we don't know who has it. You may be in contact with somebody who is asymptomatic, doesn't know they have it, they may never think that they have it, but they give it to you. And that's what we're trying to avoid. So it's not a prison. I can't direct one way or another what you do. I just want you to be careful about what you're doing and be very mindful of who's coming to visit, what the potential risk is for you for COVID-19, and rethink what you're going to do. Now, in a perfect world, if this was a dictatorship, and it's certainly not, then I would say don't bring any visitors onto the campus. But that's not what I'm going to say, and that's not what I'm going to urge you to do. But I do suggest that you be very, very careful about that. And you probably wouldn't be wrong in making that decision to not have visitors this particular time for Thanksgiving. But I'm leaving that to you. That's your decision to make. I just want you to be careful and do all the things you can to protect yourself when you do that. When you have workmen from our staff come into your apartment, it's very important for you to keep your mask on and keep your distance from the workman, either the housekeeper or a maintenance person coming into your apartment. They've got to do what they have to do their work. And I ask that you keep your distance from them and keep your mask on all the time. Our employees are supposed to keep their mask on. Sometimes they go into an apartment and the resident doesn't have their mask on, and that's not how we want to do this. Everybody's got to maintain that protocol. So either keep your mask on or leave the apartment and keep your mask on, but stay away, keep your distance from the employees when they're trying to do their work. And then we will minimize the particular risk of spread from employee to resident and resident back to employee and all around. So I ask for your cooperation in that. On some other news, our new care center is looking great. They're still moving in some beds in the new care center. The new television sets, 144 television sets have now been installed in every single new room in the new care center. The beds are all still being assembled and mattresses applied to those beds as they go around the building. It's fantastic in there. Yesterday we had a hiring event, a recruiting event inside the new care center for prospective new employees, and I think we picked up about 10 employees, probably the highest number we've ever picked up in one recruiting event, by inviting them to the new care center to see what it looked like, to see where they could potentially work. And they really loved what they had to see, and I think we had a very, very successful recruiting event yesterday in the new care center, and that's very exciting. I was down there when we signed up one of them, and her little tiny daughter that was with her. It was very cute. And I think we're going to have good success if we continue doing that and recruiting our employees and showing them the new building that they're going to work in. Tomorrow on Thursday, family members of the residents in the care center will be touring the new care center and helping select the room that their loved ones are going to live in when they transition from the current care center into the new one. That's going to be very exciting. This is really going to be the only time the family members are going to be able to see inside the building, because when their resident family member moves in, of course, because of COVID restrictions, the building will be locked down again as soon as those residents are in there, and the family members won't be able to go in. So this is a great opportunity for the family members to be able to walk through the building, help select the room for their loved one, the view that they're going to have out of their window, and to help get all that situated for us as we begin to plan moving all of the new residents in. I also want to report that we've had a very successful run at the state capitol. On Monday, we had a team of Jill Frayne and Stacy Zerbin and Tim Vossi, our CFO, testified before the Certificate of Need Committee. Actually, they did it on Zoom, but at the state capitol on Monday morning to make the case for our additional 26 bed licenses that we need in order to be able to use every one of the new 144 beds in the new care center. And they succeeded. In fact, it seemed to be an easy slam dunk for them because they made a great case and they stated a wonderful case. We had some wonderful support from our resident council who wrote a letter of support for our case. We had all of our elected officials around us in Sunset Hills and South County wrote letters of support for our case, and ultimately we prevailed rather than now having to piecemeal in additional bed licenses over the next 2 years. We got them all in one shot. We got them on Monday. So as soon as we're able to use that building and we've got all the right staffing in place, we will be able to fill up to the maximum load of 144 new residents. And that's a plus not only for our campus and for you, but it's a plus for the community around us, because we do admit a lot of residents in our care center who come from our surrounding community for that Medicare rehabilitation that they need upon discharge from the hospital. If they have their hip replaced or a shoulder replaced or something of that nature, they go to a skilled nursing facility for that rehab. And we will be able now to accommodate more of those in our private rooms without having to fight the COVID-19 restriction on isolation, because we will have the private rooms to do that we don't currently have now. So we're solving many problems in one fell swoop with those 26 bed licenses. So I want to congratulate our team that made that happen with the state capitol and the state legislature and the committee in Jefferson City. Financially, we have our results from October for not just Sunset Hills, but also for Chesterfield and for the company as a whole. We just missed our budget for last month by $18,000. Our staff has really done a great job of reducing expenses to try to match the reduction in our revenues, but there's still a gap. We're still spending direct dollars for COVID-19 precautions and preventions, the masks that our staff have to wear in the care centers and in the assisted living building, the hand sanitizer, all of the testing. That's the most expensive part, is all of the routine testing that we have to do for residents and for the employees in the care center and in assisted living. We have to pay for all of those tests that are done for the employees. Medicare pays for the tests for the residents, but we have to pay for the tests for our employees. And as the prevalence of COVID-19 increases in all the community around us in St. Louis County, the number of tests we have to conduct also increases. Whether our staff is innocent of all of this or not, when the county numbers go up, the number of tests we have to conduct goes up, and that costs us direct money. Now, we do get some supplemental funds occasionally for that, but our supplemental funds are clearly lagging behind what we're actually spending. So that is impacting our budget. We have not been reimbursed from supplemental funds for everything that we have spent. Now, we've got all of our applications in. We filed for every penny that we think we should be able to get from supplemental funds, but the money hasn't yet been forthcoming. It's been coming in dribs and drabs, but not enough to cover actually all of our direct costs. So we're behind. There's a gap. If we didn't have that gap, we would be right on budget right now. We would be doing better than budget if our census was up to normal at all of our levels of care. But as you know, COVID-19 is suppressing the number of people who want to move into independent living. It's also suppressing the ability to bring new residents in to tour the assisted living building. to tour and then decide to move in and then actually move in because it's locked down. Every time there's a positive test, either employee or resident, we have to lock down Fountain View all over again. And so that prevents new people from moving in. So our census has declined in assisted living, so our revenue has declined. And then also in the skilled nursing facility in the Village Care Center, we have the bed restriction so that when a new resident comes out of the hospital for rehab, they have to be quarantined for 14 days, whether they have a positive test or not. And then, of course, in our current facility, those are all semi-private rooms, 2 beds per room. And when we have to quarantine one new resident, that means we can't use the second bed in the room. So that is artificially suppressing our census in the care center. That's why we need the new care center, because they're already separated. They've got private rooms in the new care center, so that won't be a factor. But right now, it is a factor in the current care center. So our revenue from our census and our admissions is well below budget right now, and that's impacting us as well. Now, with licensing all the new beds in the care center, over time, I suspect we will be able to catch up as we fill those beds, but right now, our budget is behind at this point, and I know our staff is working very, very hard to also keep their costs down, and they're doing very well at that. It's just more of a gap in the revenue and in the cost, direct cost of COVID, that we're able to overcome simply by cutting expenses. But they're working very hard at doing that. Overall, we're doing well. The campus is looking beautiful. We know that the temperature dropped as of this morning. I noticed as soon as I went to my car to come to work. So that time of season is here. As you know, that we are having our hot apple cider and pumpkin latte and muffin events a couple of days every week now to try to bring a little bit of that fall atmosphere and fall flavor to you. I want to thank our food and beverage team and Jim Hunzy and the chefs for those custom-made muffins that they're making. I hope you're able to partake in those when the time comes. Again, a reminder, we are not on lockdown, but I need you to really be mindful of who you're having in to visit, making sure that everybody gets well screened, making sure they really contemplate whether they may have been exposed somewhere else before they come to visit you, and try to keep the virus off of our campus. We cannot afford to have our own epidemic on our campus, and we're trying to avoid that, but it requires all of us to continue working together to try to avoid that. Again, happy Veterans Day. I wish we were able to have our Veterans Day lunch, but we're not able to do that today. But I want to thank all of you veterans here and everywhere for all that they've done for our country to keep us safe and to make us the country that we are and the best country in the world. Have a great day today, and I hope to see you around the campus. Bye now.